After patients have undergone an IVF procedure, sometimes they have only one embryo. When they have only one embryo, no selection is necessary because we only have one. But when we have two or more, selection is necessary. Embryo selection is necessary to try to pick the best embryo to put back in first to shorten the time period to conception, and the second best second, etc. We pick embryos by their morphologic criteria. We look at two component parts to the embryo. The first component part is the inner cell mass called the ICM. The ICM is the portion of the embryo that's actually going to become the baby. The trophectoderm is a layer of cells that is on the periphery of the embryo, and these cells, called the trophoblast, are going to become the baby's placenta, or the point of attachment of the baby to the mother. Both of these component parts have to be optimized to get a good, healthy pregnancy. So there's a threshold below which the trophectoderm has to appear, and below that threshold they won't attach. And the ICM, with a very small ICM, there is not enough cells there to actually become a baby, or if it's not compacted, good-looking inner cell mass. Selection criteria for the embryo after IVF is important to shorten the time period to conception. So if we put in the best embryo first, we can shorten the time period that it takes to actually get pregnant. We do selection from a variety of ways. One, there's morphologic selection, where we look at the embryo and its component parts and how it appears, kind of like a beauty contest for embryos, and we can put in the embryo that looks the best first. If we want to go a step further, what we can do is we can actually do PGTA, or pre-implantation genetic testing for aneuploidy. What that means is we can look at the embryos, take a biopsy of the trophectoderm, the cells that are going to become the placenta, not the part that's going to become the baby, and we can send those off to the laboratory to see if the chromosomes are normal. And the vast majority of time, the cells in the periphery or trophectoderm mirror the genetic competency of the inner cell mass, the part that's going to become the baby. And in that way, we can tell whether the chromosomes of the baby are going to be normal or not. Obviously, what we want to do is put in normal chromosomes. A normal number of chromosomes in the embryo implies that that embryo has the developmental capacity to develop into a baby that's going to be born healthy.